Breast cancer is a disease in which abnormal breast cells grow out of control and form tumors. If left unchecked, the tumors can spread throughout the body and become fatal. Breast cancer cells begin inside the milk ducts and the milk-producing lobules of the breast. The earliest form is not life-threatening and can be detected in early stages. Cancer cells can spread into nearby tissues. This creates tumors and can cause lumps or thickening. Invasive cancer can spread to nearby lymph node and other organs. In other words, metastasize, which can be life-threatening and fatal.
Female gender is the strongest breast cancer risk factor. Approximately 99% of breast cancers occur in women and 0.5 to 1% of breast cancers occur in men. The treatment of breast cancer in men follows the same principles of management as for women. A total of 21,634 cases of female breast cancer were diagnosed for the period of 2012 to 2016, compared with 18,206 cases in the 2007 to 2011 report. Breast cancer is the most common cancer and accounted for 34.1% of all cancer among females in Malaysia. The Age Standardized Incidence Rate (ASR) increased from 31.1 in the previous report to 34.1 per 100,000 populations. The incidence was highest among Chinese, followed by Indians and Malays.
The overall lifetime risk was 1 in 27 compared to the previous report, which is 1 in 30. So in Chinese, it is reported that it was 1 in 22, and in Indian is 1 in 23, and Malays 1 in 30. So as you can see from the data that has been shown, Malay have the small amount of risk compared to the other race. So from elder data, the graph was plotted, and from the graph we can indicate that the incidence increased after the age of 25 and the peak age, which is 60 and 64, but it was reduced after the age of 65. Staging is the process of determining how much cancer is within the body and if it has spread.
Staging was reported for 13,485 cases. Of these, 47.9% were detected at late stage 3 and 4, which was higher compared to the 2000 and 2011 report. Nearly half of the breast cancer patients are diagnosed at stage 3 and 4. Thus, increasing awareness is important for early detection.
Are you okay? Was there something wrong with the meal? Or did I do anything wrong that hurt you?
No, the meal was fine. You didn't do anything wrong. It's just that...
Just what?
It's just that I'm worried.
You know you can trust me, right? Tell me, what's bothering you?
Okay, how do I say this? I think I have a lump near my breast, like just right beside the underarm. So the first thing that came to my mind obviously would be breast cancer. So I googled the symptoms and it might be it. And I'm scared.
Honey, you don't have to worry about it. I mean, your assumption could be wrong, but even if it's true, just know that I will be with you throughout the process, okay?
Okay.
What symptoms that you have that makes you think you have a breast cancer?
I recently discovered that I had a lump near my breast area.
Wait! Symptoms of breast cancer can include a breast lump or thickening, often without pain, change in size, shape, or appearance of the breast, dimpling, redness, pitting, or other changes in the skin, change in nipple appearance, or the skin surrounding the nipple areola, abnormal or bloody fluid from the nipple. Most breast lumps are not cancer. Breast lumps that are cancerous are more likely to be successfully treated when they are small and have not spread to nearby lymph nodes.
Did any of your relatives of yours had a history of breast cancer? Your mom, aunt, or grandma?
It was my grandma. She had cancer.
Well, since there is a history of breast cancer in your family, that could be one of the causes.
When we're talking about the factors of breast cancer, we need to consider the modifiable and non-modifiable factors. To make it simple, modifiable factors are factors which can be controlled by our lifestyle, including our diet, alcohol consumption, and doing physical activities, while non-modifiable factors are factors that can't be changed, such as gender, family history, and genetic conditions. However, in this video, we are going to highlight one of the non-modifiable factors, which is the family history of breast cancer. The risk of breast cancer can be passed down the family line due to the inheritance of certain genes. Having an immediate family member with breast cancer thus increases the risk of others within the family. For those who have one female relative with breast cancer, the risk is going to be double. And for those with two female relatives with breast cancer, the risk is 5 times higher than average. Having a male relative with breast cancer similarly increases one's risk of getting the condition. About 10 to 20% out of every 100 diagnosed are due to genes that were passed down through the generations.
After all, there must be a treatment for this disease. The first treatment is surgery to remove tumor. Second, external beam radiation therapy to lower the risk recurrent cancer after lumpectomy or chemo. Third, chemotherapy to destroy cancer cells by stopping the cells to grow and divide. Fourth, hormonal therapy, which is effective for expressing early stage metastatic breast cancer. Fifth, targeted therapy to target the specific gene, protein, or tissue. And sixth, immunotherapy to boost body defense. And last but not least, the seventh, osteolase targeted therapy using drugs that destroy bone.
We, as humans, should want a healthy body, but whether the natural force as humans will still age or there is a disease, but certainly not for breast cancer. So, the best way to avoid this disease is to limit alcohol intake, maintain a healthy weight by watching portion sizes, engage in at least 150 minutes of moderate aerobic exercises weekly or 75 minutes of vigorous exercise, and last but not least, quit smoking.
Raising awareness pre-1970s. Before the 1970s, breast cancer awareness and screening programs were limited in Malaysia, resulting in late stage of diagnosis and limited treatment options.
Emergence of awareness 1970s to 1990s. During this period, there was a growing recognition of breast cancer as a significant health concern in Malaysia. Awareness campaigns, educational efforts, and early screening programs started gaining attraction.
Advancement in diagnosis and treatment in 1990s until 2000s. The 1990s and 2000s witnessed advancement in breast cancer diagnosis, including the introduction of mammography and improved imaging technique. Treatment options also expanded with adoption of chemotherapy, radiation therapy, and surgical innovation.
Focus on research and education, 2000s until present. In recent years, there has been a notable emphasis on research initiative, genetic testing, targeted therapies, and personalized medicine in the management of breast cancer in Malaysia. Educational campaigns, support networks, and survivorship programs have also become integral parts of the comprehensive approach to the breast cancer care.
Current challenges and future outlook. Despite progress, challenges such as access to healthcare, disparities in screening rates among different populations, and the impact of lifestyle factors continue to influence the landscape of breast cancer in Malaysia. The future outlook includes ongoing efforts to improve early detection, enhance treatment outcomes, and promote holistic support for individuals affected by breast cancer. After receiving treatments and a lot of support, she is now cancer-free, and they all live happily ever after.